We get support from Audible. We've all got busy schedules. And I'm sure sometimes you feel like, with all the things you have to do, it's hard to find time for the stuff you love to do, like reading. That's why Audible is so great. Audible offers an incredible selection of audiobooks across every genre, from bestsellers and new releases to celebrity memoirs, mysteries and thrillers, motivation, wellness, business, and more. Plus, as an Audible member, you can choose one title a month to keep from their entire catalog, including the latest bestsellers and new releases. And also, I have to say, I love how the Audible app makes it easy to listen anytime, anywhere. When you're traveling, working out, walking, doing chores, wherever your day takes you. Cleaning the bathroom has really never been more fun. Let Audible help you discover new ways to laugh, be inspired, or be entertained. New members can try it free for 30 days. Visit audible.com/listening or text listening to 500-500. That's audible.com/listening or text listening to 500-500 to try Audible free for 30 days. Audible.com/listening.
Hey folks, it's Matt Zachary, and welcome to VAX On, a brand new weekly segment of my podcast Adaptations right here on the OffScrip Media Network.
Hey, I'm Elura Nanos. I'm a lawyer, a journalist, a mom of a teenage narcoleptic, and a professional big mouth.
Lou and I go back 30 years as best friends, and we're here to have fun and bring you a layperson's guide to what the hell just happened this week in healthcare as America gets its vax on and shows COVID the door.
Matt gets me. He knows I'm tired, annoyed, and sometimes pushed to the brink by the intense chaos of our lives right now. We're here together to learn, complain, and include you in the conversation.
So join us on Twitter at VaxOnPod and share your stories and grievances using the hashtag VaxOn. Conspiracy theorists and haters shall be neutralized on sight.
All right, Matt, let's get at it. Hello, we're back. How are you?
I am doing adequate.
What did you do this week? Anything?
Honestly, my brain has been always falling apart for 25 years. I guess I'm a neurological Jenga puzzle at this point.
Oh, that's true, right? You have brain issues in the best of times.
But the thing is, like, there's kind of an event horizon where the axes cross about aging versus late effects. And I think I've reached that point, but COVID has clearly, very clearly, exacerbated that. And I just think even though we're at this wonderful cusp of vaccinations are starting, numbers are really down. I'm not fear-mongering over this fourth thing they're projecting at some point. I feel really good, but it's not quite catching up to my neuropsych at this point.
You know, it's funny that you say that. I feel the exact same way, where I want to be really hopeful. And I absolutely feel like because of the vaccine that there is a light at the end of the tunnel. But it's like that tunnel is so fucking long.
Yeah.
And where I am right now still sucks. And because there's still nothing to do. And, you know, although it's getting safer, not everybody is vaccinated. And it's just annoying. You know, so I was reading this article.
Wait, you read?
I mean, well, ish. Maybe somebody shared it with me. I did read it, though.
Yeah.
And sometimes knowing that other people are miserable for the same reason just helps. It really, like that misery loves company thing.
It's universal suffering.
Right. But this was so, I thought it was astounding.
I didn't see it. What is it?
So it's an article from The Atlantic written by Ellen Cushing. And she wrote an article about how the pandemic really is having neurological effects on people. And I'm not talking about COVID, not talking about people who had COVID. I'm talking just about the effect that the pandemic has.
Writ large on society.
Yeah. And she was talking about how lots of people are having memory loss. And
I'm sorry, what?
Yeah.
And you are?
Yeah. They're having, like, people are forgetting the faces of people that they know. They're forgetting longstanding appointments that they used to have all the time. And it seems like it's actually pretty prevalent. And she was saying that she asks herself questions regularly just to, like, make sure that she still knows the answers. Yeah, like what's the name of that coffee shop I used to pass? And like
COVID fog.
Yeah, and it is. It's like a COVID fog, but it's not really because of COVID. It's because
society has completely upended itself from social interaction and normalcy.
Yeah. So I think, you know, so many of us have felt that on an emotional level, but it's really kind of weird to think about it on a neuro level that, you know, are our brains functioning the same way, or are they different? And so have you felt that you like forgot stuff or think differently, or, do you have anything like that that's happened to you?
I think when I get really stressed,
Yeah.
my brain just shuts off for certain things.
You know what I've found that I don't forget a lot of things, but I have a hard time sometimes getting dressed, like putting together outfits, because it's like I've been wearing sweatpants like all the time.
Forgotten real clothing?
I literally forgot how to put on like an outfit, so obviously you dress for like the weather and for the occasion. It's like, I don't know what to do anymore. I don't know what's appropriate for any particular environment anymore. And I keep showing up places where I should be a little bit professional, wearing like jeans and Chucks. And like that I get there and I'm like, no, this was wrong. And I can't seem to figure it out. It's very strange. But, in the article, there were some neuroscientists that were quoted in it where they explained that this is really a very real thing and that it's not necessarily all bad. One of the neuroscientists, Tina Franklin, said that the reason that this happens is because our brains are very good at forgetting things that we don't really need. So, for example, let's say you need to remember the name of your coffee order every day that you would have given on the way to work, and now you're not going to work. Well, you don't really need that anymore, and theoretically, it'll sort of come back when you need it again. We have new habits now, so our brains have adjusted to the new habits. So
right.
in a way, it's that should be heartening because it's like adaptation.
But then it's like decoupling that new learning back to normal.
Well, one of the things that I hope to happen to all of us is we've had to all make these crazy changes during the pandemic, and hopefully some of the ability to be flexible will stick with us. So I know that for me, like I always focus on one thing, and my one thing is that during the pandemic, I did a lot more outdoor stuff because that was the only way that I could see my friends, was to do things like go walking or go kayaking and be with them outdoors. And I'm hoping that I hold on to this idea of when I'm bored and I'm thinking of something fun to do, that my brain goes to an outdoor activity as opposed to only thinking of restaurants and shows, which is where my brain used to always go.
Right. So it's like for you, in your particular case, the pandemic gave you the outdoors where that may not have naturally happened.
Exactly.
And now you don't want to revert
right
to the reclusive indoor xenophobe
right.
that you were.
Right. But look, let me say this. While it did give me the outdoors, it also took away other things. It took away like all of my patience. It took away my ability to talk on the phone. For some reason, I just didn't want to talk to anybody on the phone anymore. So, we lost stuff, we gained stuff. I hope I hold on to the good stuff. But I just thought it was interesting. Like all of us have been dealing with all of these different effects of being in the house for a year and all that. And I always think it's interesting to know, hey, no, this is like science. This is a real thing that happens to your brain.
Well, we talk about trauma as an influence on your endocrine system, your neuromuscular system. Your body gets used to certain high levels of tension and stress. And they always say like the worst day of cancer is your last day. Ideally, if there's a last day, you ring the bell, you go home. What's next? Your body's so used to that frenetic uncertainty of stress and anxiety. When it's a different version of that, like the next day, you don't know how to react to it.
Sure. Yeah, because your body gets used to that. That's your routine. That's your new routine.
Exactly. So what's the big takeaway here? We're all fucked.
I mean, I don't know. I don't really know. One of the things that the doctors said that I thought was a really important message is that the thing that you can do, the thing that's good for yourself to combat any kind of brain fog or that kind of thing, is physical activity and novelty. Physical activity, of course, we all know is good and is the antidote.
Like macrame.
Right. I just bought a basket with macrame. But like take up a new thing and be new at things. Lanyard, puzzles, crocheting.
Right. You mentioned on the show last week that you went to puzzles like on day one of the pandemic.
I did. I'm all about the puzzles. But I mean, just doing anything new and talking to new people, having new experiences, that process of learning and doing stuff that breaks up the monotony, that in and of itself is helpful on a neural level. I know that for me, it makes a big difference. And I am interested to hear that it makes that difference like more globally.
Well, I hope that helps you.
I mean, sure. Do something new. Report back next week on what you will find that's new. Matt and the new things he's going to do.
Dear Lanyard. Moving on.
Does it have to be, why does it always have to be crafts? Like,
arts.
I hate crafts.
What else
I hate
is there?
crafts. I hate crafts. You know what else there is? the fucking gardening. People with the gardening, the obsession with, I mean, you live in Brooklyn. I live in the suburbs. People are obsessed with gardening. They started gardening the minute COVID hit.
Turnips.
Turnips
matter.
Let me tell you something. If you see me out there with some topsoil and a shovel, call the authorities.
Okay.
Okay? That's
Deal.
like the last step for me. I don't want to deal with nature on any level. I want it to be there. I want to look at it. I don't want to make it.
So pick your novelties wisely.
Yes.
So what's up for the next segment?
Okay, so we got some stuff we have to talk about. We have to address it. I feel like I need you to be with me through this information. Okay, I need support for this information.
All right, so I'm Fraser Crane.
Okay.
I'm listening.
Okay, here we go. So you know how we've all become like obsessive about statistics during this time because COVID has been about nothing if not about statistics?
Right.
So one of the things that we're finding now is that the statistics about COVID deaths have been wrong.
No surprise there.
Right. So like we're trying to track how many people died from COVID, and it turns out that we are seriously underreporting the amount of deaths that occurred from COVID for a variety of reasons. We're not talking about intentional underreporting. We're talking about, in the beginning, no one really knew. People died. They didn't know that what they had died from. Now, even when we do know, it's very difficult to change death certificates. Even if we know the person had COVID, that's like a whole big song and dance.
There was a big, I'm not going to say scandal, but they were not sure whether people were dying of COVID or like this goes back to cancer. You don't die of cancer. You die of organ failure because you have cancer. So is it fair to say that if someone dies of organ failure because they had COVID, do they die of COVID? And does that count?
Right. And I think in a kind of common sense, kind of common conversation kind of way, we would all say, absolutely. Nobody is interested in like, well, what was the exact last straw? It's kind of like, well, what made that person die?
Right. Would you have died if you didn't have COVID?
Right. And if legally, that's how you do it. You say if the event is a substantial factor in whatever the damage is, then it's the cause.
Right.
And things can have more than one cause, anything that's a substantial factor. So
right. Listeners, Elura's a lawyer, in case you missed that fact.
Yes. But I mean, so much of the decision making has to do with what the statistics are. And if we can't trust the statistics to be accurate, then what the hell are we supposed to do with it?
Right.
So, I mean, I don't know. I bring this up really for no reason other than to complain about it.
Well, it's just dumb fuckery.
Yeah. And I don't know that there's like a solution. I mean, I don't even really know whose fault it is.
Right. Where do you get your facts from is not even relevant here.
No, the facts aren't even facts.
Yeah.
Like nobody even knows what they are.
Right.
And, Ohio and Indiana, Virginia, they found 6,000 unreported deaths. But then there's like other places that have other deaths, and who knows?
And the Cuomo stuff, which we won't
was
get
it counted
into.
twice?
Yeah.
And did Cuomo fix it or not?
Yeah.
I don't know. I don't know. Did he have
There's
someone
no
say?
There's no repairing this in post-production either. Like it's done. It's happening.
It's over.
Yeah.
Right. Yeah.
So where do we get new data, the right data from? That's probably an open-ended, unanswerable question.
It is. But I think there's probably people who are in charge of, epidemiological data.
Yeah.
Right? To know, like,
Good
just
syllables.
sort of,
syllables.
You like how I said that?
Yeah.
That was a lot. I said it like it was no problem.
Epidemiological.
That was like a, like very percussive, like epidemiological.
Yes.
I could rap that right now. But I mean, there are probably standards and practices, and maybe things need to be adjusted now for like long term. It may not even affect COVID and COVID deaths, but if, for other illnesses or something, I mean, who knows? I don't know. I just know that it's disheartening to me that we know, here's what we know. We know that we don't know.
Well, and then it ties into the other thing I wanted to talk to you about, which is now data is almost irrelevant if we already know that states have taken opposite approaches and have the same fucking result.
That is
Let's
something.
talk about it. Was it California and
Florida?
Yeah.
Literally keeping me up at night.
What's the article about?
The article says that California and Florida had literally opposite approaches to COVID, right? California shut everything down. everything.
And Florida said, what's COVID?
Florida was like, whatever. And they ended up with the same amount of COVID cases per capita of the population. So when I first heard this, I was like, no, it's probably that they're counting the wrong thing. Nope. They're counting how many COVID cases like per capita in the population. And it was the same, even though the states had the exact opposite approaches.
So what does that say to the people that hated everything from both sides? We're all wrong? We're all right? There's nothing.
I don't know. I mean, the experts in the article that I read about it, they attributed it to, even if there are restrictions, not everyone will follow the restrictions. And even if there are no restrictions, people will still be cautious. Some people will still be cautious.
So it's compliance.
Right.
Or the illusion of compliance.
I have to tell you, though, I don't buy that, because I really believe that when there are massive restrictions put in place, some people will follow them. Some people will be very strict. Some people will be moderately strict, and some people won't follow them at all. But I just don't believe, maybe I'm too optimistic, I don't believe that when the government says we're shutting down the state, that it has no effect on people's behavior. I just can't believe that.
Well, what is it? Ellen DeGeneres says that 38% of statistics are made up on a spot. So I'll just make this up right now. So here in New York, again, the COVID tracker in the city here is that Manhattan had the lowest consistent incidence rate of all the boroughs across the board. Staten Island went up and down, Brooklyn went up and down, Queens went up and down,
but Manhattan was the most
itself
consistent.
was consistently under 1 or 2% for the entire year. And I attribute that to the culture and the compliance. So is that endemic of just the way that a city construct is built? Or, we're just one little tiny borough in a giant state. So you can look at Florida, like maybe certain pockets stayed at 1%, but other pockets were at 80%, right? So is it fair to look at California's massive? We have 30 different states, right? So to see different outcomes, to your point, I'm just trying to extrapolate. Is it really about compliance? Really good here, really bad there.
So, right. So you're saying that maybe it's that each of these states has the same number of different kinds of spots, and each spot will deal with it differently, right?
Right, it nets out.
I mean, I could see that. I could see that being the case. You'll always have in any community some people that really listen, and some people that are less cautious, and some people who are having super spreader events, and other people who are like not leaving the house. So at the end of the day, it all evens out because we're sort of all Americans, and it ended up being basically the same.
Well, there's no one size fits all. There's a bell curve for everything. People's behavior, however extreme or not extreme they're going to be, it's fake, it's a hoax, or I'm wearing a hazmat suit every day on the subway. You're going to get a blending that nets out in the middle. And maybe the middle is the results of California and Florida.
I guess, but I have to tell you, this like short circuits my lawyer brain.
Yes.
It really does, because what I have to take away from this is that regulations in general that deal with individual behavior could potentially have absolutely no effect. You could have one state with really good regs, another state with zero regs, and you could have the outcome be the same. And if that's the case with other types of regulations, other healthcare regulations, gun regulations, crimes, like I can't have that be the case. I just can't have it be that it's going to net out and have no effect.
Well, they have incidental data, maybe it's anecdotal data, that on average, like the bowling alleys, the hair salons, the nail salons had a very low incidence of spread. Indoor dining had a very low incidence of spread. And yet the church groups and the senior centers and the congregations of larger groups in private settings were the real spreader events. So just because the state says a school's closed but stores are open, the incidence is irrelevant to either of those, because most of the spreading is happening in the homes, in the gatherings, in the backyards.
Right. So yeah, and I also always want to look into that even further and say, when we're looking at these different pockets and saying, like you said, bowling alleys aren't super spreaders, and even airplanes aren't, and then parties tend to be. I wonder how much of that is about the event and how much of it is about who goes to those events. Right. Some different people go to different things. Different people frequent the grocery store as compared with frequenting a bar, let's say.
Well, look at the Sturgis rally, right? Fairly consequential event that happened last summer in South Dakota, North Dakota?
Dakota.
Dakota. one of the Dakotas it happened in, and they were able to trace that X amount of people died because of it, X amount of people got COVID because of it, and it spread across all 50 states over the course of a couple of weeks. That type of event is different than going to a hair salon, a nail salon, or a school.
Right. And I'll tell you, I wish I had known this earlier because the nail salon was what I missed most.
Right.
The nail
You
salon.
could have gone the whole time.
It was literally the first place I went back to. And when I went back there, it is like being in an actual bowl. Like I have to like be in this box.
Yep.
And
like the marching band we talked about last week.
yes, right. Like the marching band in the little pod.
Yeah.
So, and I'm like, listen, if I have to die to get my nails done, I'm from Staten Island. Manicures are mandatory.
Bring it on.
Bring it on. I will be so careful. I'm like literally there with my sanitizer spraying things down, and it's been fine and no one's gotten sick. So hooray for acrylics.
And now for some ads.
Has your chronic illness made it difficult to continue working in the traditional way? Want to learn how to find and create flexible remote work that both accommodates your chronic illness and generates an income? Join the Patients Getting Paid membership, a community of chronicpreneurs where people just like you find workshops and trainings, weekly updated condition-specific gigs, twice monthly coaching calls, co-workings, accountability, and the kindest community to support you on your path to make money while working from anywhere and taking good care of yourself. Learn more or join us at patientsgettingpaid.com.
We all struggle with feeling like there's not enough time in the day to be productive personally or professionally. We all struggle to make our time matter. It's time to take control. It's time to start investing in the corporation of you. At Athena, they've helped over 700 ambitious professionals achieve more by connecting them with best-in-class, globally remote executive assistants. Athena executive assistants go beyond basic administration tasks. They help you make time matter through the art of delegation. They believe delegation is the superpower of all highly successful people, and your personal EA will help you get there. Your EA is a one-on-one long-term partner to help you achieve your personal and professional goals. Take back your time. Join the waitlist at athenago.com. That's athenago.com.
Hey, there's some good news though.
I think we like to end the show with good news because we talk about all sorts of possibly worse news. To just it can only go downhill from there. So let's go on the positive side. What do we got?
I was so happy to read about this, that it looks like people who have had COVID may only need one dose of the vaccine.
Regardless of whether the dosing of the vaccine is 2 shots or 1 shot?
Yes, they're saying that one dose of any of the vaccines supercharges a person's antibodies so much that it has such an extraordinary result on your immune system that there is some good evidence that once a person has had COVID, they may not even need 2 shots. Now, that's not to say if you have had COVID and you have a vaccine, you should disregard the second shot. But it is looking like the science supports that 1 shot may be enough. So this is important, even though people may still be getting 2 shots, because it just shows that the vaccine can be so powerful.
Well, this also goes to the unknown millions of people who are asymptomatic that are walking around with antibodies that don't know it, that are going to wind up getting 2 shots anyway. Because they're not going to screen you for antibodies before they decide you're getting 1 or 2 shots.
Exactly.
Getting the shots.
But it's great to know just for sort of for the future, as we get more and more data, it's really important to know this, that it looks like a possibility that despite the fact that people's immune systems vary from person to person, there is some very good evidence that if you've had COVID, 1 shot does what you need. This could be significant. So we'll have to kind of keep our eye on it and see what the scientific community says about this as we get more and more information.
It's like when you buy the iPhone 11 and the next day the iPhone 12 comes out. Really? I didn't have to get that second damn shot. I was in a bed for 48 hours.
But for now, go get the shot, do what they tell you, all that. Speaking of getting shots, did you hear this about our friend Yo-Yo Ma?
Oh, Yo-Yo Ma.
I say this like I wish he was my friend.
I mean, but could he really pick you out of a crowd? Probably not.
Probably not.
Okay.
I just want him to be my friend because I find that he just looks like such a nice guy. And this is what I love. So Yo-Yo Ma went to go get his vaccination.
And of course, he brought his cello.
Obviously, he brought his cello, right? So this was premeditated.
As one does.
As one does. If you were Yo-Yo Ma, that's what you do. And got
cello will travel.
Exactly. Well, I mean, cello can be useful. Like, what if it was a long line? He could take a seat on it. Like,
yeah, that's true.
Entertain himself, get some practice time in, entertain the crowd.
Which he did.
Which he did when he was done getting the shot. He gave a little concert. He played some Brahms. He played some Mozart. And the people were just delighted around him.
Ode to mRNA.
Exactly. And let me just say this. I mean, first of all, I wish I had been there. I mean, that is so cool. Because when I got my vaccine, I remember it just felt like such a joyful experience. But if you had followed up with a live Yo-Yo Ma concert, I mean, come on. Like, what's better than that?
Billy Joel showing up.
I mean, maybe somebody call him. Where's he been?
I wonder if anyone was like, shut that guy up. And like, no one had any idea who he was.
No. That would be great. But I feel like this is like life goals. I want to be the kind of person in whatever industry that when something happens, I just like show up and do my thing, and that like puts the, that is the thing to do. Like nothing happens in the world unless Yo-Yo Ma is there to play the cello at it. Berlin Wall comes down, Yo-Yo Ma's there. Vaccines happen, Yo-Yo Ma's there. Sesame Street gets filmed, Yo-Yo Ma's there. Like I want to be like that. Like, where it's not real unless you're there to put your little stamp on it.
He's like the Bernie Mittens version of music.
Yes. Yes, exactly. I just love that. I feel like how cool. Like he's not giving concerts to make money or even necessarily just to entertain people. He's like, this is important. I've got to go be my Yo-Yo myself at the vaccine line.
Yeah, and he said, the quote is, I just wanted to give something back. Oh, and he did.
As if this man hasn't given back enough already.
Right, exactly.
So wonderful. But
well, good for him.
Good for him. This is great.
Shout out to Yo-Yo Ma.
Shout. There's a sentence no one's ever said before.
I know. And we just said it.
We did. So maybe he'll come on the show someday.
Dear Yo-Yo Ma. I'll tag you in the tweet for sure.
Please do.
What's your favorite Yo-Yo Ma song? Tweet us at VAX ON Pod.
I'm dying. Oh.
Good stuff.
Yeah. Listen, bring your instruments to your vaccine. Tweet us videos of you playing your musical instruments on the COVID line.
That's the new challenge. It's the vaccine music challenge.
Why are we not doing that? I should have brought my piccolo, man.
Oh, my God.
Little stars and stripes on the vaccine line. That would have been awesome.
We should tell our friend John to bring his sousaphone. That'll be a real hit in the crowd.
Yes. People would just love it. Oh, but you're not, because you got to wear the mask. So you could play the cello in a mask.
Accordion.
Yeah, exactly.
Not bagpipes, sorry.
Cellist.
All right, well, I think that's it for this episode of VAX On. We hope you had as much fun poking a stick at all the crazy fuckery we're talking about.
Hope your brain isn't too fogged this week. If you forget something, tweet us and tell us what it is.
If you remember what you forgot.
If you remember what you forgot.
All right, we're good. We're baked. Good night.
Good night, everyone.
That's all for today, folks. If you like today's show, the conversation continues on Twitter at VaxOnPod. That's VAXON Pod. Be sure to subscribe, leave a review, and tell all your friends to listen. VAX ON is a product of OffScrip Media. Our executive producers are Matthew Zachary and Elura Nanos. Our senior producers are Brianna Seeley and Andrew McDowell. It is mixed and edited by Brianna Seeley. Our theme music is by Chair Model. For advertising and media inquiries, email media@offscrip.com. Hit us up at contact@offscrip.com to share comments, feedback, and make recommendations. For more information, visit offscrip.com.